February is American Heart Month, a time when all people, especially women, are encouraged to focus on their cardiovascular health. There are some simple signs that you need to be on the lookout for, and these are things that are just often overlooked. Dr. Shetty with the Women's Heart Program at UofL Health is here to talk us through those basic things that we all should be looking out for. And Dr. Shetty, great to have you back.
Thank you.
These are really basic things that I think a lot of people would think, oh, I just ate something bad. I just have indigestion, and that's nothing.
Yep.
That's simple.
Exactly.
Yeah.
It's very important to identify because sometimes your heart is telling you it's struggling. So you really want to go to the ER or get medical attention because it's okay if it's a false alarm, but what if it's not?
I don't want to take that chance, get to the doctor. We're really kind of focusing our Heart Month here on Great Day Live around women's heart health.
Yes.
Because I think that's something that is really overlooked. We associate this with men.
Yes.
But why is it important to focus on women's heart health and heart disease?
I think, Claudia, you know, we're so good with screening and prevention with the bikini area, so the breast and the gyne organs. Yeah. But the fact is that most women in the U.S., actually, the biggest killer is heart disease. Yeah. So one in
especially in Kentucky too, right?
Especially
Our
in
stats in Kentucky are terrible.
Oh my gosh, yes, absolutely. 1 in 25 women will die of breast cancer, but 1 in 3 is going to die of heart disease.
Oh my goodness.
And not just that, it's about maternal mortality. It's the biggest killer of new mothers. But the good news is that 80% of heart disease is preventable. So that's why we need to start talking about it.
What are some of the signs and symptoms of an underlying heart problem or even heart disease that women need to look out for?
So a lot of times it is the classic chest pain, chest discomfort, feel like an elephant sitting on your chest, which men experience as well. But a lot of times the symptoms are more subtle, especially in the elderly or women who are diabetics. So it might just be indigestion. You know, you take a few Tums, it doesn't go away. Breaking into cold sweats. Feeling fullness or, you know, pain in the upper belly, discomfort going to your back, your shoulders, your jaw, your neck, down your arms. Don't ignore these things if they come on suddenly. Right. If you or one of the women that you love is experiencing this, go to the ER. And
some of the signs you're describing, just listening to those, they're very different from men.
Yes.
Right, that indigestion, and men, you describe a sudden, they always describe a sudden pain and that pressure of the elephant on your chest. The women, there's just a whole lot of other things.
Exactly. Men are predictable, right?
Yes.
So with women, you have to have a higher threshold.
Are there other risk factors for heart disease? You know, I think, is it true, like if you have a lot of stress in your life, can this contribute to heart disease?
Yeah, absolutely. Everyone talks about the big 3, you know, hypertension, diabetes, and bad cholesterol, the silent killers, and obviously smoking. But now we know that there are some non-traditional risk factors that are specific to women that have emerged. And some of those start during pregnancy itself. So high blood pressure during pregnancy, gestational diabetes, preterm delivery. Then there's autoimmune diseases such as rheumatoid arthritis or lupus. History of breast cancer, because chemotherapy itself can be directly toxic to the heart. Also radiation, because you're applying it to the chest, which is where the heart is. And lastly, depression. I mean, the mind-body axis, it's a real thing.
Right. So now the good news. What can we do to prevent it?
No, fantastic question. A great place to start is your diet, because we joke that heart disease is a foodborne illness, right? A vegan diet is best because it really lowers your inflammation. But if you can't stay away from animal protein, think about the Mediterranean diet. There's a lot of resources online. Physical activity. Your heart's a muscle, so you really have to condition it just like any other muscle in the body. 30 minutes a day, that's all it takes.
That's it?
That's it.
That could be fast walking.
Exactly. It's something simple. Whatever you enjoy, do it, because it's going to reduce your stress as well.
Everything you're talking about really kind of underscores the need to have like a good relationship, a good place to have a conversation with your doctor. And I mean, what you all are doing at the Women's Heart Program at UofL Health is exactly that.
Absolutely. No, the thing about the Women's Heart Program is that women have traditionally been, you know, ignored or dismissed, and we need to change that. We need to give the women of Louisville the cardiovascular care that they deserve, which is what we're trying to do here in a safe and welcoming environment so that they feel heard.
Right, and I mean, just by being here and having this conversation, thank you.
Of course, our pleasure.
Such great information, and we've just loved having you here and the Heart Association throughout the month of February. Important stuff.
Thank
All right, so if you want to learn more information, just go to UofLHealth.org.